healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinx Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Hello, everyone, and welcome to Office Hours. I'm Stuart Newsom, and today we're talking about the new revenue cycle reality for acute care leaders. This is a very interesting conversation, and I'm happy to have it with some good folks that's going to be more experts than I am on the subject. But as we know, the conversation is going to center around the fact that margins are very thin with hospitals in particular. There's any practices as well. There's always issues with denials and resolving those denials. There's also staffing issues. So we're learning that a lot of these issues are very commonplace, but they're also very solvable. At the end of the day, we just can't operate the way we are in revenue cycle on yesterday's operating manual, so to speak. So joining with me today is we have Jason Adams, who is the president and chief operating officer of our acute care team here at Infinx. We also have Peggy Kelly, who's our senior vice president of revenue cycle. And we also have Tim Anderson, who's the executive vice president of revenue cycle, here to join us and go over this discussion today. Because we really want to focus on what can operators do differently in the revenue cycle to help them tackle a lot of the things that are going on in today's world, especially with technology on the rise and the fact that nothing seems to change ordinarily the way people are doing things the way they've done them in the past. So I just want to give an opportunity for you guys to introduce yourself, say a little bit about yourself if you want to. Tim, Peggy, Jason, how y'all doing today?
Stuart, thank you for the time and the opportunity today. Looking forward to the conversation. And from an introduction perspective, here at Infinix, been in revenue cycle majority of my career outside of starting in the clinical setting, and looking forward to the dialogue today.
Awesome.
Yeah, I'm really glad to be here today with colleagues, and been in the ambulatory world for quite a while now, and the evolution of the ambulatory experience and how we saw physicians shift into employment with hospitals. It's been intriguing over the course of time. So interested to talk about that today as well.
Awesome. All right, Peggy.
Thanks, Stuart. I too come from the ambulatory world side of the business, and I have spent my entire career in revenue cycle. So I look forward to today's discussion.
Awesome. Well, then we'll get started. Y'all ready to kick it in?
Let's do it.
Awesome. Well, the first question I want to direct at you, Jason, is when you look at revenue cycle today, what feels most different from a few years ago, and why does the old operating model feel more strained now than ever?
What feels different is everything's different, from recruiting and getting people even interested in joining the revenue cycle side of the business, getting individuals to start their career in coding, billing, collections, and the finite details of operating within a revenue cycle space. Other things that feel different is we can't continue to do what we've always done with the rapid expansion of how technology is changing our world every single day. The augment and implementation of AI, and by definition, everyone has a different definition of AI, plus adding in automation, adding bot technology, and adding better ways to do it, because hospitals are faced with key challenges. Number one, margins are shrinking. Number two, the cost of care is increasing at exponential rates relative to supplies, pharmaceuticals, contracted services, everything from a materials management perspective. Physical plants are aging, which is requiring more capital to invest in the physical structure. So they have to collect every penny, and they have to do it at a lower cost, because they can't go without bedside care technicians, whether it be a medical assistant, a nurse, a specialist, or the like. Hospitals are challenged more than ever to do things better at a lower price point.
Right, exactly. I couldn't agree with it more. And as if the challenges are getting steeper and steeper and steeper, but they're still expecting the same results out of how they've been doing things in the past. So I know we'll dive a little deeper into some of those
I was
differences.
going to ask Jason, even looking at the employment models now for hospitals and how it's stretching the administrative aspects of it. That's an interesting twist that I think administrators now have to pay attention to every day.
Correct.
The insourcing and the outsourcing too. I
Oh,
think,
yeah.
is so complex with a hospital system.
Yeah, and when you have to depend upon every single dime, or much less maybe any, to squeeze out, sometimes you don't recognize where that revenue is. But we're going to get around to discussing how that's possible, right? So, Peggy, this next question, is for you. So, when you think about ambulatory revenue cycle traditionally, and we know that ambulatory, touches hospitals as well, where do you see revenue leakage hiding most often, especially across scheduling, eligibility, prior authorization, documentation, coding, and follow-up?
Well, I think you're going to have revenue issues on the front end and the back end. I think from a front end perspective, if you're not properly handling your eligibilities and your checks for your authorizations at every single visit that a patient presents, then you will ultimately have an issue on your back end
Mhm.
and your workflows and actual revenue. If you're not doing eligibilities, it's possible for a patient to be completely uninsured and you're unaware.
Mm.
From the back end of revenue cycle, if you don't have a good revenue integrity department that is constantly checking for inappropriate payer payment, payers continuously improperly load providers to where they're not actually bumping up against the appropriate negotiated fee schedule. So if you don't have monthly routines or weekly routines or daily routines, if you can get to that level of your revenue integrity, then that's just going to walk right out the door.
Mhm. Exactly.
Yeah, great.
Yeah. And taking that, what you're speaking of is a proactive approach, because everyone in revenue cycle in particular, whether it's, hospital, ambulatory, or combination of all, it seems to be this, they call it the cycle. It's like, okay, well, we're going to deal with that later down the road. We have a process here in place that we're going to follow. Then later down the road, there's going to be someone else who's going to catch it and rework that claim, which is kind of counterintuitive. You're spending more money.
It's expensive.
It's very expensive. A couple $100 to rework a claim,
Absolutely.
much less the expense of what to get the claim out the first time. So it makes sense to do everything that you're talking about, catching it every time on the front end. And sometimes that's difficult. We've been singing this this tune, for years now, it seems like, in revenue cycle, but we still can't quite get a grip on it, so to speak. So Tim, kind of leading to you is, revenue cycle change is not just a process change. So kind of a little segue from what I was just talking about. It affects people, it affects roles, affects morale, and it also affects trust. So how should leaders guide teams through that kind of change without losing high performers or creating more uncertainty? And I guess for more context, it's just been inundated with technology. We've always had technology to assist us, whether it's EHRs that came on the scene, now it's AI coming on the scene, automation coming on the scene. Those things have been there, but kind of how's that fold into your answer?
There's always been elements of change, but a demarcation period to me was COVID, which shifted the whole focus of even where we saw personalities in the office now all of a sudden working from home and now wanting to stay working from home. Examining all of those processes that are developing around a workforce that's not always together, but bringing them together is critical. And particularly your high performers, you want to make sure they're affecting those that are sitting at home. And that's not unusual for these constructs today. As we lay out, having a workforce that's effective, communicative, but at the same time, being able to adapt to what is the realities of today. And then you introduce AI to all of this and the discussions around the efficiencies that it can create, but the disruption as well. And is it positive disruption or negative? Because you can have very strong positive disruption. And disruption can be a very good word.
Right.
But you've got to move that labor force in a way and in a communicating to them the changes that they need to make to be effective, but at the same time, leave them with some creativity. It's very important to make sure that particularly those high performers can think and contribute, with unique autonomy.
Right. Right.
I think a key thing to add onto that, Tim, is team engagement. So where we touch many organizations nationwide, those best practicing organizations focus on human capital, focus on their core values, focus on true team engagement. How are you measuring engagement? How do you measure success? making sure that the team members are truly engaged, not through lip service, but through return demonstration and through any mechanism that organizations can assess for and measure for team engagement in a systematic way, so that you're gaining the feedback from the front lines. Now more than ever is the time for leaders to listen
Yes.
and really absorb what team members are telling them to ensure that they have the materials and equipment to be their best and do their best every single day.
Yeah, that feedback loop is critical.
Yeah, it sounds like communication is key. And it's
Absolutely.
key to anything, right? Any relationship you have, break down communication. I don't know whether it's your friends, your
Marriage, whatever it is, failures to act, but that communication is right. All right. That would be the big emphasis.
Exactly. Well, coming back to you, Jason, why has revenue cycle become a strategic executive priority for acute care organizations, not just an operational function?
Well, expanding upon that first answer, and executives now with tightening margins, they can't skimp on clinical staff. There has to be the professionals there to care for the patients, whether it's in the inpatient or outpatient or ancillary setting. They have to find ways to be creative, to be more lean, not to necessarily riff staff, but to be more efficient on increasing volumes, because reimbursements declining all across the board, whether it is a government payer or a third party, doesn't matter. Reimbursements going down, complexity of care is increasing, acuity of care is increasing. So the intensity of clinical care is the highest it's been, looking at the data that CMS provides. The executives now need to have a strategic view as to how do I lower my cost model so I can divert the spend where it matters. Pharmaceuticals, supplies, contract labor. So it is now bubbling up to the board level where executives and administrators are being accountable to their board to find ways and have a part of their strategic planning process that they can lower their cost to collect.
Sounds like making a plan for where you want to find that revenue and developing accountability, not just necessarily to the board. The board's very important, but across to each other.
Correct.
Yes. Nice, nice. So, Peggy, ambulatory organizations often have plenty of reports. I'm going to quote our CEO is death by dashboards, what he likes to say, but still struggle to know which problems are affecting access, cash, denials, and staff workload. So what kind of visibility actually helps leaders know where to act, not just have a pretty dashboard to look at?
Well, to me, the dashboard is really more intuitive to a provider. Providers really, I think, focus on a dashboard more so than I think that we would from an operational standpoint. We're going to look more at productivity reports, understanding all team members' role and responsibility, and understand what those productivity reports look like. Those also help us with our staffing models. I think also designing your work queues in a strategic way so that those cues are then flowing to the appropriate team member based on their skill set.
And specialty nuances too.
Correct. Whether that's a coder for specialty specific nuances, if it's a piece of your billing team and they're just focusing on the eligibility denial piece.
Payer understanding.
Correct.
Okay. Yeah,
Correct.
point.
It's great especially with our multi-specialty organizations. We do like to have our coders who do specialize by modality or department. We do like to have our work queues designed so that work, those denials will flow right to them because they are the experts to deal with those. And again, it just creates the efficiency that we need within our operation. So leadership really needs to take a critical approach, I think, with workflows. I think you have to have some input. You have to understand the outcomes and the way that you set those up and maintain them and monitor them and, continue to grow those work queues.
And that can sound daunting, but that's one place that automation and AI can help is where does this workflow need to go? Where does this automation need to be plugged in? Prioritizing which denials are going to pay when they pay and funnel it exactly what you said, it automatically goes to the right place. And those can be set up with automation. It's not necessarily AI per se, but it could just be good old fashioned, hey, set up parameters where it goes to this queue.
Correct.
Then there's AI that actually can prioritize, how to maximize the recovery of a certain denial, what you should spend most time on, because you can come in and you know exactly this is the order I need to work these. Not only does it go to the right place, but
Right, the propensity to,
propensity to pay.
right, correct. And then when you build those work queues correctly, you're setting up the team for success.
Mm-hmm.
And then they're going to feel good about themselves, and it will flow downhill to, impact your revenue,
Exactly.
all of it.
So Tim, when performance and staffing and payer behavior or account risk starts moving in the wrong direction, as we know it can drift.
Like everyone's seen it.
Yes.
Yeah,
Yep.
one way or another.
How do leaders avoid becoming reactive instead of to create a disciplined path forward?
My theme for today is communication. I think the richness of how you're able to build those communication lines and make sure that you're on the front end of any issues that develop, not reactive in the way described by the question. And, whatever model you build, whether you're using some hybrid approach where you're doing some offshoring, or whether you're in addressing cost, how you might approach the squeeze on margin really comes back to the idea that you're able to understand in your marketplace what key payers, what those payers are doing to you on a ongoing basis, knowing what their next move is going to be in terms of how they're going to process and pay claims. You want to keep that first claim success, but to hold on to that means you've got to watch the behaviors, the denials you're seeing, and react to those. So I just think it's very important to have a team that's constantly moving through information, communicating richly.
Absolutely. Absolutely. So that's all the questions I have. Before we go to the audience for questions, I want to point out that I forgot to mention that we are having this office hours live from our New Orleans office that we're very excited about. We're having an open house tonight for those in the area. But I don't know if Tim or Peggy, if you want to give a little more insight into how this office here is crucial, not only to the region, but also how we're expanding, operations at Infinx.
Well, everybody knows and loves New Orleans. By the way, if you need to know a good restaurant, talk to Peggy Kelly. Peggy's rich in her understanding of the foodie aspect of New Orleans. But, it's got a great airport. It's a city everybody loves to visit. We like to think so, being Louisianians. But the talent that we've acquired here over time, our affiliation with academic health systems, and those systems have about every aspect of the RCM challenge you can face. So great expert staff, great leadership, and the Infinix team. It just is the natural for us to be here.
That's awesome.
Agree.
That's awesome.
Agree.
And I want to do one more plug, and I'm going to lean on Jason to kind of help me with this one. But at the end of July, we're going to have an executive summit. Would you call it that? It's going to be in Chicago. University of Chicago will be the setting. I don't know if you want to give a better description of.
I would frame it, Stuart, as a thought leadership forum. And so we're trying to find the best and the brightest in the industry, in the C-suite, in revenue cycle management and hospital management come together to help collectively solve problems, to help collectively come together and talk through what are those strategies of success that are happening in pockets across the country, to be able to collaborate together, to work together, to brainstorm together, to come up with an action plan to help organizations foster change and foster improvement.
Awesome. I can't wait to be there. It's a great docket. It's going to be a beautiful setting in New Hyde Park. I'm really looking forward to it. I think we may even have a tour of the Obama Library, but maybe on the works. I don't know. That's maybe a little secret, but we'll see. We'll be happy for you to join us there. Just please reach out to us and we'll see if we can get you on the list to attend that. So now we're just going to go to the audience questions. I do see two here. So if one, and it's for anyone can answer, if a hospital suspects revenue is leaking across multiple parts of the cycle, how should leaders decide where to look first?
I think the key to that, Stuart, is if there's a question, have an independent entity who can come in and assess and give you a good baseline of where you are today. If you haven't had an independent third party take a look under the hood, I would recommend that. Many organizations like Infinix can come in and assess things end to end for you in a risk-free manner to be able to guide you with a plan as to here's your prioritization of where you should be focused going forward and where the priority is, as opposed to the hunt and peck method of external sources, to be able to guide the organization.
Exactly.
Prioritize leakage. Absolutely.
Prioritize leakage. Also,
Yeah.
then another question is, how do you make the case for investing in revenue cycle improvement when leadership is already focused on reducing cost? And maybe they're speaking to things such as investing in other technologies like automation and AI.
I think it goes back to an ROI or a net benefit. At times, you have to spend money to make money. If you were to tell me that, Jason, you need to invest $1 million to get 5, I would do it tomorrow. So yes, you may not be in line with the hospital's budget. However, you should be able to articulate the net gain of the $4 million on the top line or on net revenue. Yes, you may have missed your expense line, but it's going to be offset by the $4 million ahead
Yep,
of
that's a good
that.
point.
Yeah.
So look at it on a net benefit calculation, not so much I don't have the budget to do it. If there's going to be a documented pro forma done, a documented ROI, focus on the net benefit. Don't focus on the expense spend.
Exactly. It's about making a plan, holding accountable, and putting in place, not just spending for and in place. Awesome.
Yep, well said.
Well, that's all I have for the day. Really appreciate Tim, Peggy, Jason, all of y'all for joining. This is a treat to have all of you on here, some key executive leaders within the Infinix organization. They're busy folks. So for them to take the time to do this here, I really appreciate it. And also appreciate everyone in the audience for joining us today.
Stuart, just want to say thank you for the good work that you do.
Oh, no, well, thank you.
Very nice.
Can't do it without a great team. I'm just a pawn. But thank y'all. I appreciate it very, very much. So we'll see you next time.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at infinix.com. That's INFINX.com.